Now we're going to move on to On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. South Korea's new COVID-19 cases, as we just heard there, have been above 3,000 for multiple days in a row now, and doesn't appear like it's going to go down anytime soon. And this fresh surge has raised concerns of a possible explosion of cases as we head into the notoriously cold winter we have here in Korea, and as we just reported on, schools across the country, including here in the capital, the hot spot of the virus, fully reopen.
Yes, for more, we connect to Dr. Alice Tan, internist at MizMedi Women's Hospital in Seoul. Good morning, Dr. Tan.
Good morning.
So let's start with schools reopening in Seoul, the nation's COVID-19 hotspot. What factors should teachers and education superintendents keep in mind to keep the spread at an absolute minimum?
Well, first of all, unfortunately, that demographic, children between the ages of 0 and 19, is one of the fastest growing demographics in terms of new cases with COVID. So I think school administrators, superintendents need to keep that in mind, that there are just that many more children with COVID in the community right now. The second thing is, of course, all of the personal and institutional infection control measures that have been in place. They really need to make sure that there is no, dents in the armor in terms of protection against COVID-19, and that the temperature checks, the hand sanitizing, the distancing that happens in the classroom, that these are adhered to 100%. And lastly, they just need to make sure that if there is any symptom or any sign of COVID-19, and COVID-19 is a big masquerader. I mean, there's so many symptoms that can be COVID-19, and it just feels like, oh, it's a little cold, or, oh, I'm just tired because I stayed up last night. If there's any indication that the child is not well, 100%, early testing is going to be very important to keeping schools open.
Well, I have two young sons myself, both of them in elementary school, and students within their class actually contracted COVID-19, and they sent all of them home for 2 weeks, and they had to do numerous tests before they were allowed to come back in gradually. And fortunately, both those classmates recovered rather quickly. But moving on to our next question, winter's coming. Why is winter so much more of a concern than summer when it comes to rising COVID-19 cases? Is it kind of similar to the flu, where people's immune systems just generally get that little bit weaker during the deep freeze?
Well, the human immune system doesn't really change with the seasons, other than the mucous membranes, the lining of the nose and the mouth, that can get a little bit more dry when the temperature and the climate is cold and dry. But other than that, I would say it's a climate reason, it's an environmental reason, and also a social reason. So in the winter in the Northern Hemisphere, it's colder and it's drier. And what this means is that viral particles that are coated by droplets, so coated by moisture, that moisture layer can evaporate a lot quicker in the winter, and that makes the viral particles prone to staying afloat and spreading in the air much more easily. Secondly, it's cold, and so people are spending more time indoors. And then lastly, there tend to be a lot of important holidays at the end of the year, both the lunar calendar and the Julian calendar, and that's a time when people are traveling and gathering. And of course, when we're dealing with an acute respiratory illness, those are the situations that make spread of infection much easier.
So definitely we should take extra precaution during the season. But Dr. Tan, the South Korean government began easing antivirus restrictions on November 1st under the Living with COVID-19 scheme. But since then, like we've said, we've seen the number of cases rise and the number of critically ill spike even more. Do you think officials will have to reintroduce restrictions in the winter season?
Well, the Seoul metropolitan area specifically is I would say it's on the brink of crisis. I mean, over the weekend, ICUs filled up. Your reporter mentioned the numbers to greater than 80% capacity. This is the first time in the pandemic that it's ever been like this. And it's gotten to the point where there are hundreds of people in the Seoul metro area who have been waiting more than 24 hours for a critical care bed. Unfortunately, some of these people who have been waiting have died before they could get adequate care. And you talked about the winter season causing more cases of COVID. We also see more cases of acute heart attacks, strokes. We see other acute infectious illnesses. And so unfortunately, when ICUs are so filled, doctors may have to make difficult decisions about who gets the next open ICU bed. And that's really an unfortunate situation.
So on that note then, I just want to finally finish on the fact that, considering the fact there is this big shortage of ICU beds right now, those used for seriously ill patients, whether they have COVID-19 or some other serious illness, why can't the government go and ask other countries if they can get some of these ICU beds shipped over here, or if that is impossible, just basically demanding domestic producers of these beds to up production?
I'm glad that you asked this question because I'm sure a lot of people are thinking the exact same thing. But the point is, it's not just a bed. It's not just a physical ICU bed that we need. We need more personnel to staff these ICU beds. We need specialized space within a hospital that's negative pressure, that's under isolation so that other hospitalized patients will not get sick or get the COVID virus from one acutely ill infectious patient. And we need equipment. For example, the sickest of the sick COVID pneumonia patients are sometimes on a machine called an ECMO machine. In that case, the nurse to patient ratio is 2:1, so 2 nurses for every 1 patient, but that's for only 1 8-hour shift. So for a 24-hour period, 6 nurses are having to take care of 1 very sick COVID patient. And we now have more than 500 acutely ill COVID patients in our country. And so essentially, it's a staffing issue. And right now, it's not just the physical beds that we've run out of. It's really the capacity to care for critically ill ICU COVID patients that has really bottomed out right now.
All right, Dr. Tan, as always, thank you so much for your insights. We appreciate you making time for us, and we will look forward to speaking with you again soon.
Thank you.